This morning, before I go into the protocols and to give some more information on protocols, I just wanted to give some information with regards to the phase opening of Saint Lucia. And for the week beginning the 18th of May, we are looking at some of the sectors that would include health services, hospital services, doctor's offices, pharmacy, medical shops, food and beverage supplies. We're also going to have the food service industry, farmers and fishing, water, electricity, telecommunications, sanitation, gas stations, auto, vehicle, and the repairs, hardwares, financial services, the judiciary, the media and broadcasting, construction, home services, general malls, beauty services, that's beauty and wellness services, other government agencies, call centers, and places of worship, as well as gyms and fitness facilities, spots where there is not direct physical contact, and beaches that would be regulated. These would form part of the first phase from the 18th of May reopening of Saint Lucia. As far as the protocols are concerned, we are now going to look at the protocol that deals with beauty and wellness facilities. For beauty and wellness, it is important that staff at the facility conduct the temperature checks, screening of staff and patrons for respiratory symptoms, limiting the number of persons visiting and allowed in a barber shop or a hairdressing salon, pay attention to physical distancing measures, the 6 feet distance between chairs, and also the installation of physical barriers must be in place. As far as personal protective equipment, wearing of face masks, both employees and patrons will be required to wear face masks at all times. Face shields, employees must wear face shields when servicing clients. Gloves, employees must wear disposable gloves when servicing clients and change gloves in between each client. Each client should be draped with a clean cape. Disposable capes should be used if available. Smocks, employees should wear a clean smock between each client. Neck strips and towels, employees should use protective neck strips or a clean towel around the neck of each haircut client. Hand washing shall be done with soap and warm water. A minimum of 20 seconds is required for washing hands by employees between every client. Clothing for employees. Employees should arrive at the facility showered and wearing clean clothing. Employees should change into work clothing at work. Personal protective gear such as gloves, gowns, drapes, linen, and eye coverings should be changed between each client. These used items should be cleaned and disinfected or discarded in a closed container. Disinfection. All salons, shops should be thoroughly cleaned and disinfected prior to the reopening even if they were clean before the salon or shop was closed. Disinfect all surfaces, tools, and linens regularly. In the reception area, all unnecessary items such as magazines, newspapers, service menus, any other paper product, and decor shall be removed. Wipe down all seats and tables. Cloth chairs that cannot be properly cleaned and disinfected should have a plastic placed over them. Restrooms, all restroom surfaces including floors, sinks, and toilet bowls shall be cleaned and disinfected. Shampoo bowls, all bowls, hoses, spray nozzles, frost handlers, shampoo chairs, and armrests shall be cleaned and disinfected. The workstations, all work area surfaces shall be cleaned and disinfected. Pedicure bowls, remove all parts that can be removed. Clean all removed parts with soap and water. Rinse in clean water and then immerse into properly diluted disinfectant for full recommended contact time. Treatment rooms, clean and disinfect all surfaces such as chairs, tables, electrical appliances, and liners. Administrative controls. Employees who are sick will be expected to stay at home. Salons and beauty shops, owners or managers should provide training, education materials, and reinforcement on proper sanitation, hand washing, cough and sneeze etiquette, and the use of personal protective gear. For barbershops and beauty salons wishing to conduct business, you are responsible to contact the Ministry of Commerce at 468-4202. We now shall move on into the protocols for businesses and offices. That would include all offices, including government offices. Prepare a policy brief. Prepare a COVID-19 response plan regarding the new measures that will be implemented. This plan must be submitted to and approved by the Environmental Health Department. Responsibility of the employer. The employer shall supply for hygiene practices the following: tissue and waste disposal receptacles for use by employees, continuous supply of soap and water and alcohol-based hand sanitizer. Hand sanitizer must be provided in multiple locations to encourage hand hygiene. Personal protective equipment, including but not limited to gloves, face masks, gowns, where necessary, must be provided for staff. Cleaning equipment and PPE for cleaning staff. Employees' well-being. Sick employees. Employees who have symptoms of acute respiratory illness should notify their supervisor and stay at home. Sick employees should not come to work until they are free of fever, temperature of 104 degrees Fahrenheit or 37.8 degrees centigrade or greater, for at least 24 hours without the use of fever-reducing or other symptom-alternating medicines. Separation of sick employees. Provision must be made for employees who appear to have developed respiratory illness symptoms, that is cough, shortness of breath, or elevated temperatures. Upon arrival to work or become sick while at work, should be separated from other employees. Hygiene requirements. Wash your hands after using the toilet, before eating. If you cough or sneeze into your hands, follow the 20-second rule for hand washing. If soap and running water not immediately available, use alcohol-based sanitizers. Cough and sneeze into your sleeve, preferably into your elbow. If you use a tissue or a cloth, discard it properly and clean and sanitize your hands immediately. The operational aspects of the office. Workers should not use other workers' phones, desks, offices, or other tools and equipment where possible. Maintain regular housekeeping practices, including routine cleaning and disinfecting of surfaces, equipment, and other elements of the work environment. Use approved cleaning materials. All workers shall be provided and be expected to wear face masks while at work. Officers within the workplace shall maintain a 6-foot physical distance between each other. There shall be no overcrowding within the working space, a minimum of 30 square feet per individual. Employees who are receiving cash shall be provided with alcohol-based hand sanitizer to maintain hand hygiene. In-person meetings, whether non-company parties or in-house, should be limited and done virtually where possible. Employees must conduct routine decontamination of equipment and tools. Janitorial services. Cleaning staff should wear the recommended personal protective equipment, including at a minimal disposable gloves and face masks for all tasks in the cleaning process and when handling trash. Gloves should be compatible with the disinfectant products being used. Additional PPE might be required based on cleaning disinfectant products being used and whether there is a risk of splash. Gloves should be removed carefully to avoid contamination of the wearer and the surrounding area. Be sure to clean hands after removing gloves. Gloves should be removed after cleaning a room or area occupied by ill persons. Clean hands immediately after gloves are removed. Cleaning staff should immediately report breaches in PPE, example, tear in gloves, or any potential exposures to their supervisor. Cleaning staff and others should clean hands often, including immediately after removing gloves. You are asked to contact the Ministry of Commerce, the Ministry of Health for further information on businesses and offices. We move on to protocols for quarries, concrete and construction sites. Management are responsible to provide sanitary measures on the site to prevent the spread of COVID-19, example, hand washing stations, toilet facilities, a continuous supply of potable water, provision of hand sanitizers, provision of disinfectant and cleaning products. Observe physical distance measures, that is the 6 feet apart. Develop and implement a site transportation protocol. Prepare a COVID-19 response plan to identify processes for dealing with suspected and confirmed COVID-19 cases. Communicate the site expectations and prevention measures to all workers and contractors. Provide adequate PPE that is task-specific for staff. Site entry. Only relevant personnel to the workplace are to access the site. All office employees supporting a project will work remotely where possible. A daily register of workers entering and leaving site must be completed along with a health declaration. If electronic sign-in machines are used, these must be cleaned and sanitized after each use. Use your existing sign-in register. Signage reminding workers of COVID-19 physical distancing and hygiene protocols must be posted at the site entrance and in common areas where appropriate. Site operations. All work is to be undertaken in such a way as to reduce any possible contact between workers and to promote physical distancing where possible, as per the physical distancing protocol. All visitors to the sites, such as necessary delivery workers, will be restricted to one person wherever possible. These workers must follow the site transportation protocol. Leaving the site. Workers must use the sign-in register to sign out. When returning home, leaving the site, workers will need to follow the necessary hygiene measures. Each site must be cleaned and sanitized at the end of the workday or the end of each shift, as per the cleaning guide. The ministry responsible for overseeing this protocol and to which you are to apply if you are in the construction, quarrying business is the Ministry of Infrastructure, Ports, Energy and Labor, and they can be contacted at 468-4306. We move on to another area, and that is hardware, stores and hardwares. Administrative arrangements. Prepare a COVID-19 response plan regarding the new measures stipulated. This must be submitted to and approved by the Environmental Health Department. Ensure that stores are thoroughly cleaned and sanitized at intermittent times throughout the day and at the end of every workday. Provide appropriate facilities inclusive of appropriate disinfectants and instructions for employees to maintain good hand hygiene, environmental hygiene, and personal protective equipment for staff. Ensure every customer entering the store has a face mask and sanitized hands. Ensure staff with cold, influenza such as sore throat, fever, sneezing, and coughing remain at home. Ensure that washrooms are always stocked with liquid soap and paper towels, and that running water is available. Document protocols and continuously sensitize staff. In-store operations. Post signs at the entrances or the entrance and throughout the store, alerting customers that they must follow the 6 feet separation rule. Post signs for customers and employees, alerting them of efforts in place regarding COVID-19. Place hand sanitizer with a minimum of 60% ethyl alcohol in dispensers near doors, pay stations, and other high-touch locations for customers and staff use. Use a physical queue line control such as crowd control cordons at entrances of stores. Place markers such as tape or cones every 6 feet and provide customers with visible queues that support physical distancing outside the stores. Set up floor markers in stores to show people how far apart they need to be from each other when waiting to check out. Have designated employees regularly walk the floor to ensure that customers are following physical distancing rules and provide guidelines as needed. Stagger the number of shoppers in the store at any one time to allow for increased distance between shoppers, 30 square foot per person. Place shield guards in front of the cashier and or bagger that may not have the ability to stand 6 feet away from the customers. For hardwares and stores, you are asked to contact the ministry responsible, that is the Ministry of Commerce, at 468-4202. We move along to guidelines for retail of meat by local butchers. The operations. Measures shall be put in place to ensure adequate physical distances is maintained for staff and customers at slaughterhouses, meat shops, and that is the minimum of 6 feet. Ensure that adequate hand sanitizers are provided for use in the meat shop or slaughterhouse. Butchers and helpers must wear face masks at all times during operation of slaughterhouses and meat shops. Butchers must heighten general hygienic practices to include more frequent hand washing. Butchers and operators must ensure more frequent sanitization of surfaces within the meat stall. Butchers and helpers who are sick or have any flu symptoms shall not be allowed in any meat shop or slaughterhouse. General provisions. Persons involved in the slaughtering and sale of meats must be orderly, respectful, and must not hinder the inspector. Persons who are involved in the slaughter or sale of meat shall be held accountable under the appropriate laws. Persons who are desirous of local slaughtering and retail of meats must contact the Ministry of Health at 468-3703 for further guidance. We now move on to the seafood and retail outlet. For such outlets, the administrative components: close stores early to provide sufficient time to thoroughly clean and sanitize stores. Implement a more robust delivery process to customers who can be served without having to come inside the store. Provide appropriate facilities inclusive of appropriate disinfectants and instructions for employees to maintain good hand hygiene, environmental hygiene, and PPE for staff. Document protocols and continuously sensitize staff. Provide adequately designed and constructed toilet facilities. Provide hand wash stations equipped with hand drying facilities, liquid soap, running water, and waste receptacles. The health. All staff should stay at home if they are unwell or show signs of fever, sore throat, cough, shortness of breath. And if this is the case, to report this by phone to the employer for further instructions. All staff are instructed to report by phone to the employer if someone they live with is unwell or shows any signs of fever, sore throat, cough, or shortness of breath. Hygienic requirements. All staff shall practice regular hand washing, washing hands with soap and running water for a minimum of 20 seconds. Dry hands thoroughly with disposable paper towels, and also use hand sanitizer. This should be done after visiting the toilet, before eating, after smoking or vaping, before putting on or after removing protective clothing, including face masks and gloves, before handling any product, before and after cleaning, particularly after cleaning high contact surfaces. The in-shop operations, post signs at the entrances and throughout the store, alerting customers that they must follow the 6 feet separation rule. Distancing expectations through announcements periodically throughout the day. Set up floor markers in store to show people how far apart they need to be from each other when waiting to check out. Staggering the numbers of shoppers in the store at one time to allow for increased distance between shoppers, that is 30 square foot per person. Place shield guards in front of the cashier or seller that may not have the ability to stand 6 feet away from the customer. Periodical cleaning and sanitizing of highly touched areas and items. Provide sanitizing stations for customers entering and leaving the stores. So for seafood operators, you are requested to contact the Ministry of Health at 468-3700 for further information. We're now looking at the tourism accommodation service. The General Administration. Hotels must be in compliance with the Public Health Act and the Hotel, Guest House and Apartment House regulations. Accommodation provider must identify a management team that will audit the COVID-19 protocol and standard operating procedures with regular inspections to ensure compliance. Management must submit a list of all staff, copy of medical certificate, contact number and address to the Department of Health and Wellness as part of this protocol. Accommodation providers shall report any suspect case of COVID-19 to the Department of Health and Wellness. All guests on property must present negative COVID tests taken within 24 to 48 hours of travel at check-in. Accommodation provider must institute a policy for allowing guests who test positive in country to extend stay. Management must enact policy on property to manage destination image and visitor privacy. A prerequisite for licenses. Hotels must be in possession of a valid health license to operate and public health license for all relevant areas covered under the Public Health Act to include restaurants, food storage, food handling areas and kitchens, bars, beauty, barbershops, manicure and pedicure, swimming pool and jacuzzis. COVID-19 action plan. The accommodation sector must complete a COVID-19 action plan to submit to the Department of Environmental Health for review and appraisal prior to opening. The plan must detail measures put in place to address all areas of the operation to mitigate the spread of COVID-19 amongst guests and staff. Training requirements. Implementation of a robust continuing education and training system at the hotel to ensure all staff members are fully aware of the risk that exists according to duties and mitigation measures to minimize risk and exposure to COVID-19. Establishing internal communication. Implementation of adequate communication measures between managers, supervisors, and staff to ensure proper functioning and rapid information exchange in the establishment and ensuring good understanding of protocols including measures for crisis management. Assignment of a focal point. Management of hotels must ensure that there is a clear line of communication to a focal point of the health department for guidance on management of suspect COVID-19 cases. Implementation of the plan. Implementation of clear measures approved by the Department of Health to manage suspect COVID-19 cases in-house while liaising with the quarantine authority or designated focal point. Signage. Adequate posters and information should be placed in and around hotels to provide relevant information, reminders on COVID-19 action plan to both guests and staff. For example, frequent hand washing, frequent use of hand sanitizers, cough and sneeze etiquette, etc. Signage must be installed at high traffic areas, including proper use and disposal procedures for masks. Cleaning and sanitization. Frequent cleaning and disinfection of all frequently touched surfaces, for example, counters, handrails, etc. Equipment upgrade fixtures and fittings to suit the protocols. Management and screening. Establish procedure for daily screening of staff and visitors. Will require nurses and nursing station on all property that is operating. Identify a quarantine area for both staff and visitors that display symptoms. Establish procedure with the quarantine authority for a guest who tests positive for COVID-19 to be placed in quarantine isolation at the facility. Submit daily report to the epidemiology unit on the health status of guests and staff based on the parameters and reporting instrument that will be provided by this unit. Establish procedures with the Department of Health and Wellness for contact tracing. Provide disposable implements for room service. The responsible ministry to obtain information from and also to submit your application is the Ministry of Tourism, and they can be contacted at 468-4618. Next sector that we are looking at is the taxi and ride-sharing services. Basic principles. If you are unwell or have COVID-19 related concerns, call a helpline for advice before you travel. If you're unwell with COVID-19 symptoms and must travel, private transport is required. If that is not possible, call the helpline at 311 for guidance before traveling. Drivers should use hand sanitizers and offer to passengers. Keep a supply of tissue and encourage passengers to use them. Guidance for passengers. Personal hygiene. Where possible, use hand sanitizer before and after you have entered or exited a vehicle. When you get to your destination, you should wash your hands for at least 20 seconds with water and soap, and then dry your hands thoroughly. Physical distancing. Physical distancing between the driver and passengers is important, even in smaller vehicles. Perform routine environmental cleaning and disinfection of vehicles. After every journey, or when visibly dirty, wipe all surfaces that a passenger may have touched with alcohol-based wipes or disinfectant. This includes inside and outside door handles, seat and seat belts and seat belt buckles. Where available, use rubber gloves when cleaning. Dispose of them and any clean material safely when you have finished. That is placed in a tightly covered garbage bin. The responsible ministry that you need to contact, if you are a taxi operator, is the Ministry of Tourism at 468-4618. The sector is organizations, faith-based organizations. And for faith-based organizations, the requirements are all faith-based organizations are required to prepare a COVID-19 response plan regarding the new measures stipulated. This plan must be submitted to and approved by the Ministry of Equity, Social Justice, Local Government and Empowerment at the soonest, and should include the size of the building, the room and its capacity, taking into consideration the physical distancing requirement, the size of the present membership and procedure for managing numbers to approved numbers, the sanitary measures in place, service delivery and special protocols regarding vulnerable congregants, example the elderly, pregnant women, children, and immunocompromised persons. Measures for conducting funeral service, the service procedures, procedures to separate persons who show up sick or become sick at the facility. Communication plan for the congregation, including strategic placement of signs. The operations of faith-based organizations. Post several signs at and near the entrances and throughout the faith-based organization venue, alerting members of efforts in place regarding COVID-19 and that they must follow the 6 feet distancing rule. Number of attendees must be calculated at a minimum of 30 square foot per person. Announce physical distancing expectations periodically. Ensure that 6 feet physical distancing is maintained within aisles, sitting rows. Use markers on benches or place chairs 6 feet apart within each aisle. Avoid holding hands during services or prayers. Avoid handshakes as a form of greeting or sign of peace. Avoid hugging and greeting with a kiss. Modify the method for collecting regular financial contributions instead of passing a collection tray or a basket. The congregation, regular announcement to the assembly should be reiterated. Maintain a 6 feet distance. Stay home if you are sick. Practice proper hygienic protocols. Wash hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water is unavailable. Cover your cough and sneeze into a tissue and discard after. Wash hands after. Avoid touching eyes, nose, or mouth with unwashed hands. Avoid close contact with people who are sick. Wear face masks upon entering and leaving and whilst within the building. The responsible ministry is the Ministry of Equity, Social Justice, Local Government and Empowerment, and they can be reached at 468-5103. We now shall turn to the education sector, schools. School administrators and teachers, staff, the basic principles that apply. Six students, teachers, and other staff should not come to the school. Update or develop school emergency and contingency plans. School should enforce regular hand washing with clean water and soap. Use alcohol rubber hand sanitizers. Use chlorine solution and conduct periodical disinfection and cleaning of surfaces including desks, chairs, doors, washrooms, etc. Schools should provide water, sanitation, and waste management facilities and follow environmental cleaning and decontamination procedures. Schools should promote social distancing, ensure that appropriate personal protective equipment, cleaning agents, and disinfectants for cleaning is provided. School operations. Ensure schools are not used as shelters, treatment units, etc. Consider cancelling any community events or meetings. Reinforce frequent hand washing and sanitation and procure needed supplies. Provide and maintain hand washing stations with soap and potable water, waste receptacle, and if possible, place alcohol-based hand sanitizers in each classroom, at entrances and exits, and near lunchrooms and toilets. Clean and disinfect school buildings, classrooms, and especially water and sanitation facilities at least once a day, particularly surfaces that are frequently touched, examples railing, lunch tables, sports equipment, doors, windows, toys, teaching and learning aids, using sodium hypochlorite of 0.5% for disinfecting surfaces and 70% ethyl alcohol for disinfection of small items. Increase airflow and ventilation, that is, leave windows open as much as possible. Post signs encouraging good hand and respiratory hygiene practices. Ensure trash is removed daily and disposed of safely. Gatherings will be avoided by closing cafeterias and reducing the duration of recess periods. Access to school hallways will also be limited. Lunches can be consumed at the student desk or outdoors while respecting physical distances. Teachers working with handicapped children where distancing cannot be regularly maintained must at all times wear protective masks and visors. Teachers and students must wear face masks at all times. The implementation of social distancing practices stagger the beginning and end of the school day. Students must always use the same desk. Cancelling assemblies, sporting games, and other events that created crowding environments. Create space for children's desks to be at least 6 feet apart. Be reminded that a minimum of 30 square feet should be allocated per student. Handshakes and other forms of physical contact must be avoided. Teach and model creating space and avoid unnecessary touching. Discourage from sharing meals and using common eating utensils. The responsible ministry for the protocol on schools is the Ministry of Education, and they can be contacted at 468-52 6. Thank you.
You notice shortness of breath and a stark pain in your chest. You might have lost your taste and smell, and you're breathing like you just walked up 3 flights of stairs. These symptoms signal a trip to the emergency department of your local hospital. How will you be treated? When would you be put on a ventilator? And how could you develop a severe case of COVID-19 despite being perfectly healthy? Before you rush in, call your doctor or hospital ahead of time and describe your symptoms. You'll want to do this because your local emergency clinic might not have enough beds and may need to direct you to another facility. Or your symptoms might not be considered severe enough yet to require treatment at the hospital, so it's best to check by phone first. But once you are admitted, nurses will give you a COVID-19 test. Most patients will also have a set of blood tests taken from their veins. Doctors will then listen to your lungs and check the levels of oxygen in your blood with a clip-on finger monitor. Why are they doing that? Because if you have severe COVID-19 symptoms, the oxygen levels in your blood can drop too low. Since this can result in life-threatening damage to your vital organs, you'll get oxygen to breathe through 2 small tubes that go just inside your nostrils or through a face mask. You'll then get a chest X-ray or a CT scan so that doctors can get a better understanding of which areas of your lungs are inflamed. A CT scan, also known as a computerized axial tomography, is a painless diagnostic test that uses X-rays and computers to create cross-sectional images of your body. A CT scanner is a large square or round X-ray machine with a tunnel through the center. It helps doctors see into your lungs. During your CT scan, you will lie on a table that slowly passes through the tunnel. A giant ring called a gantry will rotate around your body. It contains a tube that releases X-ray beams and detectors that will measure the amount of radiation absorbed by your body. And these beams will capture many views of your body from different angles. As the gantry spins, the detectors will send data to a computer that creates cross-sectional images or 3D models of your lungs, helping doctors diagnose the severity of your coronavirus infection. Once your doctors have all the data to determine the progress of your COVID-19 infection, what treatments can improve your condition? Well, some patients may get standard antibiotics. These won't fight the coronavirus directly, but could be beneficial if you develop an additional bacterial infection in your lungs. But because there is no approved medicine specifically for COVID-19, you'll be relying on your immune system to fight off the virus and hope that oxygen therapy combined with supportive care can help your body recover. If things go your way, your immune system will start to produce antibodies to slowly kill the virus. But what happens if your condition worsens? If the oxygen concentration in your blood then drops below critical levels, doctors can escalate your treatment to something called high-flow nasal oxygen, which means that a machine will be pushing air into your nose, warmed to body temperature and humidified with sterile fluid. You can get up to 60 liters of oxygen per minute and up to 100% concentration. If high-flow nasal oxygen is not an option or didn't help, doctors will start you on mechanical ventilation in a last life-saving effort. You will be given medication via IV to put you to sleep. The first step in mechanical ventilation is called endotracheal intubation. Once you're asleep, your doctor will use an instrument called a laryngoscope. This device helps guide the endotracheal tube to its proper position. Your doctor will tilt your head back slightly and insert the laryngoscope through your mouth and down into your throat. taking special care to avoid contact with your teeth using a special blade on the device. Your doctor will gently raise the epiglottis, which is a flap of tissue protecting your larynx, as they advance the tip of the endotracheal tube into the trachea. Once the tube is in place, your doctor will inflate a small balloon surrounding the tube to make sure it remains snugly in place. They will then remove the laryngoscope and tape the tube to the corner of your mouth to prevent it from being jostled out of position. Your doctor will check to see that the tube is properly positioned in the lower part of the windpipe by inflating your lungs with a special bag and listening for breathing sounds on both sides of your chest. If the end of the tube is too low, both lungs will not receive the same amount of air. In some cases, an X-ray is taken immediately after intubation to confirm the placement of the tube. Once the endotracheal tube is in the proper position, your doctor will attach it to the mechanical ventilator, which will have a specially designed pump that aids respiration by delivering well-oxygenated air into the lungs and permitting carbon dioxide to escape.
Good day to you, our viewers. We are back with the COVID-19 response report. And this time around, it is a look back on the week that was. We're doing a week in review for the week 11th to 15th May 2020. My name is Jessie Leonce. I'm joined in studio by my colleagues Tony Nicholas, Lissa Joseph, and Carlton Cyril. We're just looking at the top stories, the major developments of the week as it pertains to COVID-19. And just to mention them, we have had 100% recovery rate restored to Saint Lucia. Our 18th case, which was the remaining case being treated at the respiratory hospital, formerly Victoria, has now recovered. And at this week, we have we have gotten back the enviable position of having a 100% recovery rate on island. Increased incremental operations. The government has announced plans for the continued phased reopening of our society in a national consultation that was held yesterday. And I think the third most outstanding development is that we have the country has been put into a water-related emergency. A pleasant good morning, good day to you, my colleagues, as we begin this line of discussion.
Good morning to all our viewers and our listeners.
Hi, morning. Yes, I was going through the week that was.
Did I say morning? It's already
It's afternoon.
I guess we're used to being here in the morning. Yes,
on the morning,
yes.
So it has been a very, very eventful morning, and past 24 hours, because as Jesse indicated, we had the big announcement that Saint Lucia's economy is opening up. So I know that it is an exciting time for many individuals, and at the same time, there's lots of apprehension.
Bonjour, si c'est samedi ou kay sav nous ka visiter tout ça qui point court pour semaine nan et quand chay pour discuter en parmi ou kay tan premier ministre ka bay permission pour un chay lot business et quand chay lot bagay point place ou kay sav moun ka parler de ça en parmi l'autre bagay nous kay parler jodi a sur les vini pour état de soukou glo ou kay tan premier ministre parler à sous ça nous kay toucher ça aussi yon a ces bagay là qui bien important pour nous discuter ou aussi peut-être attendre les vini pour situation nous nous ni 100% personnes les vini pour monde qui a recouvert nous pas une personne qui testé et puis vers maintenant quand chay pour discuter nous toujours ka dire c'est un plaisir pour nous ou en cette ici c'est gens l'autre pays noir c'est gens qui a coûté nous à sur 20 et puis l'autre radio station nous a dit merci tellement pour vous qui a coûté nous sur internet là jodi à c'est samedi quand tout le monde ici et puis nous Lisa Tony Jesse moi quand nous ka fait ça nous ka faire les samedi ba tout information et développement pour vous qui manquez en semaine.
Thanks for that, Carlton. If I could go back to, always the OECS Head of Health's statement that Saint Lucia is exemplary in its operations when it comes to managing COVID-19 here on island. And, just this week, it was another demonstration of the efforts, the feverish efforts of our frontliners, the nurses, the doctors, all of the individuals who are dealing directly with the COVID-19 patients. We saw the 18th patient, the 18th confirmed patient here on island has recovered this week, and so we now once again have a 100% recovery rate. Despite this, the threat of COVID-19 still remains, and the government of St. Lucia continues to admonish the public to let you guys know that we still need to exercise and take the necessary precautions and exercise all of the health and safety measures to protect ourselves against COVID-19. This week, the Chief Medical Officer did state her concerns with respect to compliance at the community level. And certainly she called on the leaders in the community, the persons who are leaders in mothers and fathers groups, the church leaders, the sports captains and so on, the many celebrities in the various communities to lead by example, to take charge of that and really encourage persons in the community to wear their masks, to practice proper hygiene in the community, to observe the physical distance. So officials are still observing a low level of compliance at the community level. And certainly we hope that this will improve in the coming weeks as St. Lucia increases its operations and restores our societal operations to full. We've also seen 55 samples coming back negative. That was on Tuesday, and also 59 samples came back negative on Friday, and that has brought our total number of tests to 734. So 734 tests have been done to date in St. Lucia, and just this week we had 2 sets of samples coming back and negative. Lisa, Tony, definitely seeing increase in the testing right now on island, and definitely giving more confidence, in the process as people can see this, tangible, operation.
Yeah, and I think one of the things the CMO highlighted this morning is comparing our testing rates to some of the other islands, and so far we're doing quite well with the number of persons that have been tested per capita.
But also I know that the idea of testing, that's important to know. I know the anxieties about people who are asymptomatic, so you're not exhibiting any symptoms, and the scientific reasoning is then having to test the population as asymptomatic or individuals who are asymptomatic is just really counterproductive. So what for me remains the central point is all of us, let's just play our part. All of the protocols that are out there, all of what we are being asked to adhere to, if we simply stick to that, then we will be safe. And even with the economy reopening, if we make sure that within our silos that we are going to observe the social distancing, we are going to wear the mask as often as we possibly can, because you know that there are health issues coming with that. Do you wear this all day? And so many other things that maybe we wouldn't have time to get into that. The washing of the hands. What I do, I make sure that I carry just a small hand sanitizer. I have put it in the pocket, so everywhere that I touch and then I go, I can pull it out now and really do sanitize and put it back in the pocket. So if we are doing these things, we are definitely reducing risk by doing that. And for me, that's why I feel I'm not anxious. There's no anxiety on my part with the economy reopening. I know that we've been at work, and so for us it really doesn't matter. But I really do not feel anxious with increased numbers on the streets, out in the stores, because I am doing what I possibly can to protect me and others.
It's about personal responsibility.
Moi content ça Lisa ka dia bon matin quand nous ka fait discussion. Bien vitement nous ka ver si maintenant qui te hier, yon c'est bagay là nous ka parler sur là. C'est là vini pour rapport office CMO a dit that qui nous pas ni personne à présent qui testé puis 20 000 nan, qui vle di 100% nous hawi couvert les vini pour 20 000 nan, ça pas vle di nous pas ni. Ça a été dit qui a concerné ici moi officiel qui a dit ça qui a concerné yo c'est date qui en chay moun pas ka mettre ces masques là ça bagay qui bien trois cassé avec moun en public pas vle chan distance là ça yo empêcher faire c'est moun vinn ensemble mais quand chay moun pour yon raison et ben l'autre pas qu'attendre yo ka venir toujours encore nous ka faire appel là pour di moun wete distance là 6 pieds laver la main faire ça ou supposé faire mettez masque en public là où il veut caillou faire assurer ou faire même bail la laver la main tirer had ou laver la had la toutes ces bails encore nous ka ouais les vini pour test quand te moun qui a trouvé ko yo testé nous ka ouais la mardi 55 en ces symboles à vie moun qui tout négatif yo voyé 55 après ça nous est 59 encore il vient négatif pour date 734 moun a trouvé ko yo testé tout ni fait un bon observance là là vini pour les autres ces places dans Kawaii blanc nous ka fait bien tout bonnement souvé nous a fait plus tester puis en chaidi quand c'est un bon bagay mais quand nous a bien tant que nous a touché à sou puis il y a vie ouvert yon a ces bagay là qui bien important avec moi mais ça lui ça te ka 10 encore tout le monde n'est pour prendre responsabilité ko yo point à sous quoi pour ni masou point à sous quoi pour faire si vous faire la main point à sous quoi pour dire ou ka chain distance là bien important avec moi mais c'est moi que ça sent bon bail tout bonnement.
Wonderful. I just want to shift now to the 20 more returning from the Carnival Corporation, the cruise lines. We've seen the smooth repatriation of Carnival Cruise Lines workers returning to Saint Lucia and being quarantined. Just to read an excerpt from one of the Ministry of Health's press releases. On Tuesday, May 12, 2020, the Department of Health and Wellness received into quarantine 20 St. Lucians who are cruise ship workers on the Carnival Glory. These nationals shall be in quarantine for a period of 14 days as per the country's established protocol. Over the next few weeks, we will continue to receive other St. Lucian cruise workers and eventually our returning nationals. So just to give the assurance that the authorities are working on getting all our St. Lucian cruise workers home and eventually all returning nationals, all nationals who are living abroad. If you're studying, if you're living and working abroad and you are desirous of returning home, there are efforts underway to facilitate that. I just want to go into the yesterday's activity. We saw the holding of the national consultation for the continued phased reopening of our society, and we saw the Operations Command Center, the representatives from that group coming forward to speak to us about the plans of government at this point in time. Of course, even before that, they spoke to us about, they spoke from scratch, talking about everything that had happened from January when the world, was plunged into this global pandemic, and all of the efforts that have been ongoing so far in Saint Lucia. And fast forwarding to our present time, we got word from them that we are now at a point where of increased incremental operations. So just to give you the main pointers, the zoning that we saw at the Tikai Gap and the Borderley Gap, those zoning operations will cease effective May 18th. And also a new curfew has been instituted from 9 p.m. to 5 a.m. effective May 18th. Restrictions on social activities are maintained, prohibition on crowd events are maintained, and airports are still closed to incoming flights, and ports are closed to seafaring and private boating. So we want you to take note of that. At this present time, while there are increased incremental operations, there still remains restrictions on social activities, and crowd events are prohibited altogether. Airports are still closed to incoming flights, and ports closed to seafaring and private boating.
Well, I know many individuals will be happy with the zone being lifted. Mm-hmm. I know that, sometimes when we are going through a storm, we're a bit impatient.
Yeah.
I heard many comments, you know,
Choice words.
including the threats of strike action or some form of protest action
Overzoning?
from some of the minibus operators.
Yes.
And, you know, we need to patience, because it is something that the world has never gone through before. There is no blueprint, if you will, for how you're supposed to manage something like this. But now that the zones, you know, we don't have that anymore, 5.8 and 7.58, 7.59. Now we can see domestic travel. However, maintaining this nine people on a bus, that's what it is.
Yeah.
So we still need to maintain the protocols, but at least now, people who felt that they couldn't see family members in the south and vice versa to the north, now you are free to be able to go down and spend some time with the loved ones that you felt you could not have seen.
But still abiding to the protocols.
And still abiding to the protocols, yes.
Qui c'est bonne nouvelle parce que nous avons l'instant Tony qui a mangé il en 759 il pas bac à manger ben nous avons descendu à présent Tony. Quand on bien savent mais c'est nous avons visité toutes ces ça qui fait nouvelle vieux visiter ça qui fait en semaine nous avons parlé du gouvernement qui a hier tenu en consultation côté yo te ka bail public plan gouvernement pour vier ouvert raison il vient visiter depuis temps nous temps premier par cas corona et puis aller pour nous à présent troisième stage là changer encore gouvernement te a dit yo ka ouvert place là puis il ka point 5 différents stages nous en troisième nan côté yo ka ouvert différents business leasing différents places business et ben bon à présent bonne nouvelle là qui a sorti en dedans ça hier en explanation bail avec un chaque question point l'été ni pour faire et puis ces gens qui ni responsabilité pour bail avec faire décision si et moi ensemble et puis même ministre tourisme ministre là premier ministre là mais yo répondre à chaque question avec bon matin nous ton annoncement premier ministre là parmi yo ou kay savent trouver quoi informer les vini pour ces bonnes qui étaient établi pour nord et puis sud là c'est bonne ça vini lundi le 18 mai, la pa kay ni pièce bonne encore, ou kay libre pour passer en ces bonnes et puis moun kay monter descendre ni nord ni sud pays ou kay ça fait ça. L'autre ça qui a sorti en dedans ça ou kay ça encore, les vini pour curfew yo ha gouvernement havie visité et qu'à présent curfew kay commencer lundi kay commencer 9h pour 5h bon matin encore moi répéter vini lundi le 18 mai curfew a commencé 9h pour 5h. En chaque développement qu'on a observé bon matin, nous avons passé, mais nous on est informé, nous avons en détail pour chaque ces bagages sensibles maintenant, mais pour à présent nous avons fait savoir annoncement et qui ça qui a passé. Aussi vous savez les venir pour airport a simplement point avion qui a entré et qui était fermé toujours et puis les venir ni port tout pour ces bateaux yo poko ouvert quand on est trouvé qu'on informé qu'on nous une information avec développement nous ka do quand pas ni bonne kay fermé le 18 qui c'est lundi avec les venir pour curfew pas kay 7h encore kay commencer 9h quand moun ka un petit soulagement là les ni pour faire et puis ça.
Just looking at the assessment by the command center as presented yesterday during the national consultation with civil society groups and so on between the operations command center and stakeholders in society, they explained that we were in the third iteration of phase 3. So that is the increased incremental operations. And just to let you know some of the applicable services that are in full operation right now between the up to the 18th of May, from the 18th of May, and that is health services, hospital services, doctor's offices, pharmacy, medical shops, the food and beverage supply, food service, farming and fishing, water, electricity, telecom, sanitation, gas stations. And at minimal operation, we see gyms and exercise, hardware, sports, financial services, beaches, judiciary, broadcasting, media, construction, home stores, general malls, malls, beauty service, other government agencies, call centers, and religious. And based on what you've just heard me list out there, you would have been hearing so far special announcements as to the opening of the construction sector, for instance. Yesterday, we got word that the beaches and the general malls, beauty services would be open for business, open for to service the public at this time. And now I want to move on to phase 4 and the fourth and fifth iteration of this phase, the proposed reopening schedule of the country. And I think I just want to list some of the services that we will be seeing effective 1st June. In full operation, we'll see essential and non-essential services coming together in operation, the religious sector as well. Minimal operation, gyms and exercise, sporting, bars, functions, cinemas, border opening, returning nationals, regional travel, international travel, hotels, sites and attractions. So these are some of the services that will be reopened for the fourth and fifth iteration of this cycle, the proposed reopening schedule for the first week of June, right? And one thing to note that is, I think, most important is the resumption of the tourism sector activity in the first week of June. And please note, these are just pilot efforts. The Operations Command Center will be monitoring the rollout of these privileges, the opening of our society, and looking to see what can be improved upon as they continue. Locally, tourism, there's an education component. If you were a part of the audience at yesterday's presentation, you would have heard that there is a licensing and certification program that they're hoping to implement for individuals within the hotels, persons working in the hotels, so that they better understand the ins and outs of managing under COVID-19 circumstances, and as well as stringent measures for all stakeholders. We're talking hoteliers, taxi operators, even our visitors. So the Permanent Secretary in the Ministry of Tourism, who's also part of the Operations Command Center, she did speak on how this whole tourism sector resumption of activity will play out. Take a look.
So a visitor comes to the airport and they would have to present evidence indicating that they are negative for COVID-19. There's also mask, physical distancing, temperature screening, a regular sanitization of surfaces, hand washing regime, and education of all airports involved and all participants within the chain at airports and the airline community. You'd have also heard the Prime Minister indicating strong dialogue at the OECS and CARICOM level for the past days and weeks, where all of the countries are trying to get a united front on the management of COVID and what the protocols for resumption of travel and tourism would look like for all of our countries. And one sticking point is that all visitors coming or resuming would be required to have that negative COVID test.
Naturally, arrangements have been made with the airlines, again, stringent procedures for passengers through this process, persons coming to Saint Lucia for vacation.
We also have the dedication from the airlines that protocols will be adhered to include mask, physical distancing, and minimizing the contact with cabin crew, as well as in-flight service, looking at things like packaged meals, ensuring that there is limited interaction of use of washrooms on short flights as much as possible, ensuring that there are wipes of course with the right chemicals in use for visitors on flights to use. On arrival at the airport, there are protocols that already have been given by the Ministry of Health to the Saint Lucia Air and Seaports Authority, and we could attest out of engagement with SLASPA and the other service providers that there has been work in instituting these protocols in lieu of travel. Some of the activities there within the protocols to note is the sanitization of luggage, the queuing up and ensuring that there's a slower process in deplaning so as not to allow large congregations. There's also increased infrastructure for fever monitoring and other screening at the public health station at the airports.
And the final clip on how the tourism sector will resume operations in Saint Lucia is when visitors get to the hotels.
From the airport to the hotel, it's only authorized tourism taxi, which will be authorized to transact business at this time. Suffice it to note that with the protocols issued by the Ministry of Health, all tourism service providers in the first phase, which is the test phase, will be required to have met all of the protocols and to be issued with a tourism license from the Ministry of Tourism to indicate that they could commence operations. We also have at the hotel, the level of participation with the protocols would include a revision of the guest reception procedure to ensure that all staff are outfitted with PPEs, to ensure that as far as the restaurant and dining is concerned, that the buffet service is revised. And so there would either be no buffet service or a system where the food is enclosed and you have an attendant providing service to visitors. The hotels will also be required to have an extended opening of a nurses station to assist in daily screening, as well as to be able to assist the Ministry of Health in collections of samples where it may be seen that persons are presenting themselves with anything looking like COVID.
Other requirements at the hotels, we're seeing a minimum stock of empty rooms for quarantining, limited guest activity, physical distancing. Hotels would be required also to launder staff uniforms to avoid them commuting with it on and increasing the risk of transmission going into their homes or coming into the hotel compound. So definitely a cloistered experience, a cloistered tourism experience at this time. But again, we're hoping to resume, again, trading of health and safety with our economy. And of course, tourism being our lifeline, we have to try to see how we can resume tourism operations in Saint Lucia.
Well, I know that there's a lot of anxiety over that announcement, Jesse. I think that if we think of it only in the case of Saint Lucia and believe that it is only Saint Lucia opening up, and it is only Saint Lucia taking the risk of wanting business and so forth, then it will be a very frightening thought. But this will not work if the entire world is not on the same page. And as we know, Prime Minister Honorable Alan Chastney is leading, the lead Prime Minister for the reopening of the tourism sector for the OECS and CARICOM. And so there is that joint collaborative approach that is being taken. So what is being announced in St. Lucia, surely it will not differ to what Antigua and the rest of the islands in the Caribbean would be doing. Perhaps a little tailoring here and there to meet their own specific situations. But by and large, it is a sort of joint approach to that. But further afield, I was reading an article from The Guardian, which was posted, so individuals can look it up as well. It was posted online May 12th, and it's entitled, "What is the Future for Travel and Migration in the Age of COVID-19?" And there, I'm just going to isolate a portion here, an excerpt, and it says that the leaders of Austria, Greece, Israel, Norway, Denmark, the Czech Republic, Singapore, Australia, and New Zealand have agreed that as each begins to ease restrictions, they could capitalize on low infection rates by creating tourism safe zones. Israel, Greece, and Cyprus, tourist-dependent nations, are already discussing the idea in the Eastern Mediterranean and hoping to partially open up from July. On Wednesday, the European Commission is expected to recommend a three-phase approach to reopening borders that brings together member states with similar overall risk profiles. And any reopening would be very gradual, however, with authorities prepared to shut back down if the virus reemerges, which is what we heard the Prime Minister say for the case of Saint Lucia, and I believe that would extend throughout the Caribbean. But the point of this is that the competition just never ends. So these, on the other side of the world, we have these countries with their vast beauty and resources thinking about the same bread and butter issues as St. Lucia, and looking for a way to see how they now can capitalize on COVID.
As well.
So, and it's not just that, but just our neighbor to the north, Jamaica. The Jamaica Tourist Board has partnered with destinationweddings.com to host a virtual symbolic ceremony for couples who had to postpone or cancel their Jamaican destination weddings as a result of COVID. Now, registration closed on Tuesday this week with 126 couples set to participate in the virtual ceremony, which will be hosted live on Zoom from Laughing Waters, Jamaica on Sunday, May 17. So the ceremony would include the exchange of vows, live music, a unity ceremony, scenic shots, and a special toast by the Minister for Tourism, Edmund Bartlett. The couples will also receive a special offer if they book the destination wedding at any of the 17 Jamaica resort partners. They will receive 3 free nights in an upgraded room category, plus an additional exclusive amenity during their stay, a complimentary wedding package, and complimentary arrival service. Now, I read this out again to show that the competition is there. I remember I had a program with the manager for the NSDC, and I had made the point to her that when COVID is over, the world is going to emerge ferocious, and the competition will be never ending. So when our minister, Honorable Dominic Fede, had the virtual marketplace discussion with Canada, one of the travel agents there, so the questions were, but why? Why are we doing this? COVID is around, shouldn't we? Business just never sleeps. And so if we on this end decide, well, COVID is here, we're not doing anything, we have to wait until the vaccine is found for us to, we will be lost.
Yes, it's a question of remaining relevant in the marketplace. And you mentioned something earlier about the anxiety when person said tourism. But I think part of that anxiety comes from what our perception has been with tourism over the years. You mentioned the Eastern Mediterranean. Some of the comments I've seen when the announcements came focus on the UK and USA, as if that's the only source market that we should be targeting. But what about staycations? What about, beginning from the OECS level? So they have different levels towards this thing. I do not think, and I don't think anyone expect that when the hotels open in June, that you'll have this influx of persons from the USA or UK. I think it's all going to be incremental. So some of that anxiety, I think, is just coming from a misunderstanding or what have been a false perception over the years. Before I throw it over to Cokes, I was just hoping or wondering, Lisa, you mentioned a couple of things, if you want to put in a hint out there about what you're looking at when tourism is concerned, but maybe you'll tell us after the show.
Exactly, un bon bagay pour nous ça. Avant les mots paroles ça, nous ka dit nous ka continuer de ça qui fait un semaine quand parmi développement ka bien ça veut venir pour consultation qui était point coup hier ici à Point Seraphine, pays a ouvert et puis nous dans stage 4 troisième stage là, mais nous quand entrer en quatrième et cinquième là. Qui ça qui a fait? Eh ben, il a proposé date qui activité là il pour faire et puis affaires touristes qui point pour un premier mois. En première semaine mois prochain, ça c'est le 1er juin. Là où nous t'en hard PS qui est responsable pour les affaires touristes, Mazé Vité, qui t'a dit yo kave première semaine en juin, mais en chaïba qui prend en considération. Yo fait ça engagement yo a fait et puis c'est plein c'est genre compagnie c'est avion pour dire ça panique by Saint Lucia qui a fait. L'autre bagaille là c'est hôtel là kaitan yo vle entraîner ces moun ça. L'autre bagaille qui kay point coup ou kay savent là ka parti là kan tout conditions pour entrer parmi yo ou ni pour dans yon jouer be 2 jours mouché ou a un test négatif avant ou même ça entrer. Quand en considération là avec discussion c'est nous pas c'est pas Saint Lucia simplement ka essayer hen moun vini avec des nou ni Covid ko nou ka mener moun aller annoncement fait première semaine en juin nous ka veille c'est une date qui proposée quand si bagarre aller plus mal nous peut-être pas kay même moins date ça mais ça qui bien important yo ja dit c'est place business là qui ka accommoder ces moun dans hôtel guest house c'est place ça ou ni pour faire application depuis à présent quoi c'est pas ni kan bail ka fait là même.
Well, definitely there are fail-safes that the government has in its holster in case things don't go according to plan. You know, there are triggers to revert to previous phases, if we have an increase in community spread, if there are any shortcomings in the health sector. You know, in addition, there are steps required. There are conditions under which the government of Saint Lucia has approved of us moving into this next phase, this reopening schedule that we're seeing. I just want to go to a news report that we have on the framework to reopen Saint Lucia Society, the consultation that was held last week, just to wrap up and give persons a greater understanding of how the government of Saint Lucia is proceeding with the increased incremental operations.
A 5-phase approach is being recommended for the reopening of St. Lucia's economy, which includes Phase 1, A and B, Phase 2, 3, 4, and 5. St. Lucia is currently in the 3rd phase, Increased Incremental Operations, which commenced on the 27th of April 2020 and is due to end on the 31st of May 2020. Each phase is being monitored for triggers that call for moving on to the next phase or reverting to the previous phase. Sharon Gardner-Hippolyte of the Performance Management and Delivery Unit in the Office of the Prime Minister explained that the foundation is being laid so that the country can move into the 4th phase. The Command Center has established several goals for this phase, including large stimulation of the private sector and economy, ensuring healthcare resilience by building capacity at hospitals, reinstating some soft social sectors, and the reopening of the tourism sector under strict protocols defined by a new licensing regime. Gardner-Hippolyte highlighted Phase 5.
Finding our new normal, Phase 5. What is our goal? International travel to commence with strict protocols, hotel and tourism sectors to be able to open up again with very strict protocols, and some of this will be discussed in more detail by the Permanent Secretary in the Department of Tourism. Steps required in each phase is vigilant screening at our ports of entry, mass testing programs, and continual refinement of new standards and protocols. As we continue to develop, and each time going into a new phase, we have to make sure that the protocols and the guidelines are constantly being monitored, evaluated, being implemented in all of our sectors, and that they are also being updated in accordance with international best practices.
The Ministry of Health and Wellness has instituted and will continue to institute new measures based on the phase and the sectors to facilitate the safe reopening of the sector. Chief Medical Officer Dr. Sharon Belmar George explained that one such sector is the education sector. Students of grade 6 are expected to sit the Common Entrance Examination on the 30th of June 2020, and Form 5 students are expected to sit the CXC examination on the 29th of June 2020. As such, they will be allowed to attend school for the month of June under strict protocols.
In this phase that we are now in Phase 3, our discussions have been on the facilitation of national and regional exams, that is the Common Entrance and the Grade 6 exam. So as we continue collaborating with education, we decided that the rest of the school community would remain closed except for those critical years and those with the practical component. So we have prepared very strict guidelines with the Ministry of Education to ensure that the limited period of instruction is done safely to reduce transmission, to facilitate the Common Entrance exam, and to facilitate the CXC exams in the Form 5s. So we are hoping that we get the cooperation of the various stakeholders with that.
Of course, during the course of this coming week, we will be going more in depth with the proposed reopening schedule of the Operations Command Center. We do encourage you to stay tuned. It's heavy programming we have in relation to COVID-19, our management of it on island. As we're going into this increased incremental operations, we do hope you stay tuned, you keep informed so you understand what businesses are available to you as we go into the first week of June. Yes. I just want to go to a break at this point. When we come back, we will be opening the lines. So we do hope you can call in and make your contribution on how the government of St. Lucia has been managing COVID-19 so far, as well as what's happening in your area. Stay tuned.
Virus ready to harm us. Panic is not the answer. We can win this together.
Often use hand sanitizer. Better yet, use soap and water.
We must protect each other if we are to beat this corona.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are up. No, no.
Advice give you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for Saint Lucia. Together let us win this war. Saint Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
Thank you so much for staying tuned. This is the Week in Review, the COVID-19 Response Report. We are live from the GIS studios. We are live on NTN. If you're watching on air and online, a special welcome to you. We invite calls at this time, a very tight schedule today. Starting from this morning, we saw the Honorable Prime Minister and Chief Medical Officer in studio giving an update to follow the national consultation yesterday. The number you can call is 468-2162. 468-2162. Definitely a packed schedule, as I was saying, and it has really tightened up on our schedule for programming today. We will hopefully be wrapping up in the next 30 minutes. We do hope you can call in and make your contribution. Meantime, this week we had International Nurses and Midwives Day being observed. That is our largest largest group of frontline workers at this time, and kudos to the nurses in Saint Lucia who have been at the front of this response to COVID-19 in Saint Lucia. We do have a clip from Alicia Baptiste, the president of the Saint Lucia Nurses Association, speaking in the context of, nurses now dealing with the COVID-19 situation.
The response to the pandemic showcased to the world that nursing really is saving lives. 2020 is an opportunity for nurses to better explain what they do, to break the myths around nursing, and to advocate for investment in the profession. Yes, Year of the Nurse plans have changed. But look at what is happening with COVID-19 and the nursing response to it, and how actually it is highlighting and showcasing and profiling lots of things that we wanted to achieve out of the Year of the Nurse and Midwife. Not in a way we would have wanted. None of us would have wanted it this way, but this is our reality, and this is what nurses are doing. Each of the nurses working with these patients is potentially putting their own health at risk. And we know that many nurses are contracting the virus around the world, despite their best efforts to keep themselves safe. Governments need to acknowledge the role of nursing in the front line against the virus, and we need to put nurses right at the center of our planning and of the support we are providing.
We have a call on the line. Good day. No, we don't have a call. Okay, well, that clip was just there from the president of the Saint Lucia Nurses Association, Alicia Baptiste, speaking on International Nurses Day and the importance of nurses, even as we have entered this very uncertain time of this global pandemic. So that word there coming from the nurses. We'd like to again thank all of our frontliners. I know the Prime Minister got emotional yesterday in his closing remarks at the national consultation. People are on edge. There are people who have been working very long hours, and we just want to commend you all and thank you all for your efforts so far. Going further into... We have a call on the line? Hi, good day.
Hello? Hello?
Hi, good day. You're on the line.
Yes. Supposing you have your grandchildren in Saint Lucia and you want to bring them back away.
Okay, can you just bring down the volume of your television set?
I have no television set by me.
Okay. Well, thank you. Can you just continue?
Yeah, I said if you have your grandchildren in Saint Lucia and they're returning to the island, can you not ask for a COVID test for them so that they should not be placed in quarantine when they reach there?
Well, it is mandatory. It is part of the procedures for the response to COVID-19. They must enter quarantine because the initial test may not result in the condition of the individual. So the person will be placed into quarantine, initial test will be undertaken, and I guess they would do follow-up testing during the quarantine phase of that individual to ensure beyond shadow of a doubt that that person is COVID-free.
But I'm not, caller, are you still there?
Yes, I am.
No, did you say, we had a little difficulty in hearing you clearly, but were you referring to children returning?
Yes, children returning to the U.S.
Okay, how old are these children?
To the U.S.
To the
5
US.
years old.
Oh, they're 5 years old. They are returning to Saint Lucia from the U.S.
No, I want them to return to the U.S. from Saint Lucia.
Well, the U.S.
Oh, then the U.S. will be the one to deal with that.
They would have to determine that, whatever procedures they have in place to protect their population.
Okay, thank you very much.
You're welcome.
Moi just voulais dire ligne nan ouvert et puis ou peut couiller sur une pièce conseil et ben on voulait information ou peut couiller nous ici à Limois c'est 458 Dayon 6D 4682162 of course we are bringing you the week that was moi ici à moi Lisa Tournier puis Jesse papa mi bagay nous a discuté live vini pour semaine qui passé ou ka observer yo teni moi joie yon c'est joie observer qu'on joue nos et femme chay côté au ka mouche importance nos en bon bagay moins que nous tout ka à présent encore nous ici à prendre opportunité à vous dire merci pour travail lancé nos qu'a fait qu'a mettre la vie en danger et qu'a trouvé tous les jours pour hen kouay là pour hen patience là et puis pour traiter monde qui est testé positif et même travail en ces situations ça. Quand on regarde nous ici à GIS Headquarters COVID-19, quand nous avons information les semaines avec développement qui après coup hodi c'est samedi. Merci tellement ou ça couiller comme on dit ligne non ouvert. 468 Dayon 6D.
Yeah, and just want to alert the general public, the government of Saint Lucia has declared a water-related emergency in Saint Lucia. I just want to read out the prohibitions that have been outlined in the legislation. The following prohibitions apply: the use of water supplied by or obtained through the pipes of the Water and Sewage Company Incorporated for the washing of a vehicle using a hose, for watering of a lawn, hedge, garden, farm, ground and recreational field, for pressure washing of a house using a hose, or watering or washing a roadway, pavement, path, garage or outroom, for concrete mixing and block making, to fill a leaking or an overflowing storage tank and a swimming pool. So these are the prohibitions. At this time of the water-related emergency, you would all be aware now by the looks of the grass in your lawn, that we are in the midst of a drought. So at this time, there have been prohibitions on the use of prohibitions in certain applications for the use of water that we get from WASCO at this time. The tampering of the Water and Sewage Company Inc. infrastructure to divert or abstract water from its network, that is also prohibited. The abstraction of raw water upstream of a Water and Sewage Company Inc. infrastructure is also prohibited, as well as an activity which may require the use of a considerable or excessive quantity of water. In short, we are all being called to use water, be conserve water as much as we can. If you don't need to have the tap open, if you don't need to use, the water that is coming out of the tap, you have it open, please close it. Please, we want to practice conservation at this time to be able to tide our way through this drought season compounded by COVID-19.
And I think perhaps if Roger has that at hand, we did have the Water and Switch Company, the representatives on one of our discussion programs, and that would have been last week, Timothy James, and he puts into context exactly what it is we are experiencing. It's beyond just the grass out there being brown. The water levels, we have just dropped in that drastically. So if we can have that insert from Mr. Timothy James of WASCO, putting into context for us exactly what's happening with the water supply.
What we're realizing for the month of April, our rainfall for the last, say, 6 years, this year has been the worst in terms of the data we gathered. And it has, shown its face. We lost about 6 feet of water from the John Compton Dam in March. And to date, in the last 2 months, we have lost about 12 feet of water. Our maximum level is about 343 feet above sea level, and we're now at 321 feet above sea level. Now, all persons know of Hurricane Thomas and our heavy siltation at the dam. And because of that heavy siltation, we do not have the volume of water which would maybe normally keep us right through the drought or the dry period. And so, to put it in summarize it, we literally have between 5 to 8 feet of water to manage throughout the balance of the dry period. We had a meeting with the Flood and the Drought Committee on Thursday last, and based on the statement, we are expecting at least 2 more months of very dry weather, which means that though you may see rain, but the rainfall will not be as normal, and so we still have to be, actually, that these next 2 months will be even more challenging for us in terms of managing the water supply we have in our various intakes.
And so that's really a picture of what we are facing where water is concerned. It's not at all heartening because we know during this COVID period, that what do we talk? Wash your hands, wash them clean. So we have to be very creative as to how we're managing this. But during the program, Timothy James made a very, very interesting point when he said that what are households doing to ensure that the water supply within the household is there. And people are no longer buying buckets and wanting to store water at their home. There is a sole reliance in some households just for the pipe-borne water. So we will not make it. And we spoke last week about going back to basics. That rain harvesting, he spoke about that as well. I know that's something Tony knows about very well, right, Tony?
I wonder why you think I know about it.
But I know that, Tony. Your mother taught you well, so
definitely
I know that.
Having those drums outside, and yes, certainly. I think it's something we all need to look closely at. And I mean, Jesse just mentioned, we're looking at the water crisis on top of COVID, but let's not forget we're going into a hurricane season June 1st. So, so those problems compound each other. So again, whilst you have central government and your various agencies, your WASCOs, having their role to play, but it goes back to personal responsibility that we all need to take personal responsibility for the part that we need to play within this crisis.
Moi vle toucher un petit akan ça parce moi quoi est bien important pas dit nous va parler about glow quand ils savent nous dans état de soukou là il vini pour glow et là annoncement a trouvé quoi il fait là il vini pour qui ça ou ça fait et qui ça ou pas supposé faire dans temps quoi présent et quand parmi ces bagages là qui halon maintenant pas ça laver machine ou en rose ou pas ça user flow ou pas ça user zeb ou dans la cour pièce jardin ou ni quoi ou pas ça fait ça, ou pas ça point pour pressure wash kai, ou pas ça point les vini sous ni swimming pool si ka couler, ou pas ça do ka servir en rose pour vieux plein pièce ces bagaille ça qui bien important aussi, yo l'emmène on les vini pour monde qui ka prend glo peut-être en tête l'oeil vière et ben pour faire yon bagaille ben l'autre ou est-ce qu'on ka dit ou pas supposé faire ça en temps qu'on à présent parce que ou nous tan hod monsieur Timothy James yon a ces bagaille là qui bien si puis moi-même pour tan date qui en 6 l'année nous a trouvé qu'on nous dans position côté à présent qui en vérité nous trouvé qu'on nous côté nous dans position nous ni 6 pieds glo 6 pieds glo et puis à présent yo ka dit 12 pieds glo qui nous ni pour tant ka wem nan ki wete a quoi dam nan yon se bagay lan chay moun ka dit nous nan dam mais yon se bagay lan monsieur Titus excusez-moi Timothy vie fait nous changer tant Thomas changer dam nan trouvé quoi il plein sable terre quoi côté glo supposé nous ni tel quoi gloire nous te supposé ni pour l'air qu'on nous est là nous pas ni ça pièce et vous savez ça qui est bien frémissant c'est date qui nous ni 2 mois pour aller toujours et quand 2 mois ça monsieur James Hodwasco a dit nous ni pour faire puis ça nous ni là et pas oublier l'appli qui kay tomber pas kay assez pour nous aller juste en temps kawem bout mais nous ha ka parler nous ka dit nous ni saison cyclone nan hurricane ka vini quoi qui ça peut fait moun ni pour prendre responsabilité à présent kayo ça fait moun ga bocher bouchio dans yo et qu'on ni si t'es non ouvert moun ka laver assiette yo ka wè ses assiette si t'es non ouvert et yon a se bay lan li ça bien dit nous te ka parler dia lè vini pour moun ka gagner bon pour faire si wè yo ni glo là mais c'est si pièce tant poko fait à présent c'est là pour faire nous ni pour commencer point précaution puis glo et préserver glo parce que nous ka besoin.
One final note on that, I know a lot of people talk about the John Compton Dam. The Minister Ezekiel Joseph indicated on the program earlier this week that to desilt the dam is an 8-year process. So I know everyone says just get the silt out. An 8-year process that is highly technical, which must be done in stages. So believing that we can simply get all of that silt out and everything will be back to normal, it just isn't so.
Wow. So I think based on all of the information we've since heard that we are in a drought, we have to deal with COVID-19. We still need water for sanitation purposes, as well as the upcoming hurricane season that we have ahead of us. We do hope that you take all the measures that you need to, and as outlined within this water and sewage water-related emergency declaration order, you do not wash your vehicle with a hose, you do not water your lawns, your hedge, your gardens, no pressure washing of a house, no water for concrete mixing and block making, no water to fill your leaking or overflowing storage tank and swimming pool at this time. A person who contravenes this subsection commits an offense and is liable on summary conviction to a fine not exceeding $3,000 or to a term of imprisonment not exceeding 6 months or to both, and to a further fine not exceeding $50 for each day during the contravention, during which the contravention continues. So do please take note of this. We do hope that you take all the necessary steps to conserve water. Our time is running out. We'd like to thank each and every one of you for watching. This has been the Week in Review. We did see much more happen. We had the panel discussion that was on Sunday night, where we reintroduced to us was the medium-term development strategy. We had the chief economist speaking about how the MTDS can help us at this time of COVID-19. We have a lot of capital projects coming out of this strategy, and of course he stated that it was shovel ready, and so hopefully we can see these capital projects begin to stimulate the economy in a time when we've had the collapse of so many sectors due to COVID-19. Also, we had during the panel discussion, we had Investment Services Manager at Invest Saint Lucia speaking about how we can go about, well, she did acknowledge that competition will be fierce, as you mentioned, Lisa, you know, very ferocious, and at this time we need to secure and keep our pipeline projects, our investors who had already signed on the dotted line. We need to keep them interested in St. Lucia and go forward with the rollout of these projects as soon as possible. I just want to also make a note of, we had a case of fake news at the Ministry of Education this week. So an individual or individuals had been posting or circulating on social media that students of Form 2 and Form 4 report to the Department of Education for e-book devices. And the Department of Education, Innovation and Gender Relations wishes to alert the general public that this is incorrect and it did not originate from the ministry. The department's process is that students report their needs to their respective schools, which will in turn forward to the department their needs. And this process has been working very well so far and allows for students in all educational districts to be reached. So do please take note of that as we go forward with this e-learning, learning from home situation.
Just one note from me, which we didn't get to discuss this week, but the Department of Labor, I think we had like 50 Saint Lucians who went to Canada for the Canadian Farm Program, and that's part of a larger program within the OECS and the wider Caribbean. I think it includes Jamaica as well. So the OECS Commission facilitated that travel for 180 OECS nationals in all, including our Saint Lucians. And it's very heartening to know that they're following the protocols as they go in up there for employment. Just to tell you quickly that testing prior to departure was done, and they have to present the results upon arrival in Canada. The workers were given travel kits with their face masks, disposable gloves, hand sanitizers, etc. And the workers to be quarantined for 14 days on arrival in Canada, however, with full pay. So that is very good there, because I know that for St. Lucians, the Canadian Farm Program is a really big money earner, if you want to call it that. So remittances, and people could feel productive working and so forth. So that was good news for me for this week.
Eh bien, là, il vient pour mon parole, ça, c'est écouter, nous avons dit, Dédé, merci tellement pour vous qui écoutez, vous avez observé temps, nous avons tenu temps, bon matin, mais go nouvelle là, vous savez, c'est bon, vini lundi, nous pas une pièce bonne encore, moun qui savent voyager, sorti en sud là, vini en nord là, mais l'autre manière aussi, vous avez aussi, là, il vient pour curfew à présent, tout fait quoi, ABC, à présent, nous avons curfew qui a commencé 9h, pas 7h, pour 5h. L'autre bonne nouvelle, avec l'autre place qui a venu en mois pour venir première semaine en juin, nous avons le Premier ministre et le gouvernement Saint Lucia qui a ouvert Saint Lucia, mais et puis conditions. Merci tellement. Non, moi c'est Carlton Cyril, puis moi connaître encore que ça semble, et puis Jesse Tony, et puis Elisa bon matin, qui a aussi maintenant avec tout développement qui est né.
Thank you very much for that, Carlton. As we wrap up, we just want to say a special thank you to all of the donations, the donors this week. India donated a significant quantity of medical supplies and a grant of US $1 million under the India UNDP Fund to Saint Lucia. We also had a donation from Rubis West Indies Limited this week. They donated 2,000 surgical masks, 2,000 N95 masks, and 2,500 gloves. And we also got a donation from PAHO as well. So many thanks. We do continue the effort in our response to COVID-19 in St. Lucia, and the response of our friendly governments and the corporate sector has been overwhelming. Thank you once again for viewing today. It has been a very packed program this morning, very packed broadcast this morning on NTN. My name is Jessie Leonce, signing off on behalf of Carlton, Tony, and Lissa, and on behalf of the production team as well. We'd like to thank you once again, and do enjoy the remainder of your weekend. When we come back, it will be Monday morning with the latest updates. Cheers.